gabi na ito is actually very special because we will be talking about not one, but two important organs and concerns in the human body, and that is the liver and also the colon. So to let us know more about that, we have a very special guest who was able to give her time this evening to be with us, Dr. Diana Payawal.
Hi, good evening, sir, and good evening to everyone. I'm very glad to be here, and of course, always when there is education, we in the gastroenterology and hepatology field would like to be there.
Yes, and Doc, thank you. Doc Payawal is a gastroenterologist and a hepatologist. She is the past president of the Philippine College of Physicians and the past president of the Philippine Society of Gastroenterology, and also the past president of the Asian Pacific Study of the Liver, and affiliated with many hospitals, but primarily Cardinal Santos Medical Center and Fatima Medical Center. Tama, Doc?
Yes, opo.
Okay.
Yes.
Doc, sige, can we first talk about, because these are both very important, kaya hindi ko alam kung ano yung uunahin ko. But siguro because para bang the colon is associated with food, with digestion,
Yes.
with nutrient, para bang nutrient absorption, yan na lang muna yung ating colon or large intestine na lang muna ang
Opo,
pag-uusapan
yes.
natin. So para Doc, sa ating mga televiewers, ano po ang itong colon na ito na tinatawag?
Well, ang colon is the harbor of the dirty. Kunyari, kumain ka, pupunta sa tiyan, then it will be digested and then brought to the small intestines. And it is the large intestines that carries the excess of the food. Kaya nyo nilalabas as stools.
I see.
As
Okay.
feces. So, in any event, the colon is actually it's a dirty organ.
Yes,
Kasi
of course.
yun na yung dapat na ilabas mo. And therefore, if you have any problems related to the GI tract, yun po yung nagiging problema, ang colon.
Ito ang common dahil yun nga dirty siya, di ba,
Yes,
Doc? At
oo.
saka it is the end point. So para bang
Correct.
digestion starts, di ba, in the stomach and the small intestine.
Absorption of water happens in the colon. And then, that is why your stools are supposed to be hard. Diba? So pag ang stools mo is soft, ibig sabihin, or watery, there's some problem in the colon, you probably have an infection.
I see.
Ngayon, one of the most common causes now of GI problems that we have is colon cancer.
I see. Dito sa
So,
Pilipinas, it is one of the top 10. No?
It's actually number 4 of the top
okay.
cancers in the Philippines. Of course, the liver and prostate, the breast, are the ones ahead of it. I'm sorry, the colon is increasing. No? Siguro dahil maraming tao hindi nagpapa-undergo ng procedure to actually prevent it. No? So ang colon is, as I mentioned, colon cancer is most commonly seen among usually nasa 60s or 70s yan. But now we are seeing patients very early, 45 or even 50. And we don't know whether why it's becoming common in the earlier stage, probably because of the food we eat.
Yes, no?
So,
puro fast food, Doc,
fast foods and all of this, with less of vegetables and fruits.
And processed.
And more of processed foods. Yun po ang basic to that. Of course, it's linked to a lot of things like alcohol drinking, smoking, and even vaping.
Even smoking, Doc, is
Yes,
naapektuhan din ng
syempre
colon.
may, lahat yan. Smoking is related to GI cancers, to a lot of cancers in the organ. It's because you put in smoke.
Yes. So, kumbaga, that misconception na kung kayo ay smoker, ay baga lang ang tatamaan, hindi totoo yun.
That's not
apektado yung halos lahat.
All the organ systems, even vaping. I am very stern. I go with the Philippine College of Physicians stand against vaping, and I admire our DOH Secretary Herbosa for coming up with a program against vaping.
Because the best really is to just totally abstain, di ba?
Yes, lifestyle is actually the first. But if you cannot like stop drinking or stop smoking, there are some lifestyle strategies or modifications, we can help you. So, meron mga specialista, psychiatrists that can help you in stopping all of
weaning
these
you
vices.
off these
Yes,
things.
correct.
As in anything else naman, Doc, it just takes determination, di ba?
Yes.
Na-mention mo kanina, Doc, yung prevention, no? Ako, I always believe an ounce of prevention is worth tons and tons of cure
Correct,
pa nga.
yes.
Pagka sinabi natin, like, since nag-uusap tayo about the colon, syempre kasi hindi ito kita, no? This is inside. And alam naman natin na karamihan sa ating kababayan natatakot po magpa-check up, no? Ano ang basic preventions na dapat natin malaman?
First of all, there is already a recommendation of the Philippine Society of Gastroenterology that is actually being done by the DOH to have colonoscopy at the age of 45 to 50.
Okay.
So ito po ay because ang colon cancer in the Philippines is coming from a benign to malignant course. This is the
see.
Vogelstein theory. So may mga pasyente na may polyp. And if you have a polyp early on, we remove that because any polyp can have the risk of developing into cancer. So it's through time.
I see.
Okay.
Ano ang itsura ng polyp? And
Kuntil po yun. It's a kuntil.
And how is it different from, let's say, a tumor or a cyst po?
A tumor is of course hindi malignant na yon.
Pagka sinabi mong tumor.
Pag sinabi mong tumor, the concept is of course it's malignant. Ang benign, smooth pa siya, kaya pa namin tanggalin by our
I see.
procedures. Pag mga cancer na bumapasok na yan sa ilalim, nabubulok na yung tissue, and that is where the problem lies.
I see.
That is why kanina sinabi mo sa akin that less people actually get into these procedures. Dapat po alam natin na there are recommendations already, and the YAKA program actually covers colonoscopy screening.
I see. Kasi yun nga, no, Doc, colonoscopy is a little bit expensive, no? A little bit. Kasi
yes, it is.
Traditionally.
Yes, but there is a YAKA program, so when that includes a mammography for breast and colonoscopy for us.
So
for
generally at this
gastroenterologists.
point in time, there's really no excuse not to get your
Yes,
colonoscopy
kasi nga,
done already.
nakita ng gobyerno, tumataas ang colon cancer. So anybody at the age of 45 to 50, you have to go to your doctor. There are programs that
Yes,
we actually adhere to. In fact, March is a colon cancer month, and at that time, most of the gastroenterologists will undergo diminished package. Yung ibig sabihin package, ibig sabihin yung pwede kang mag-feel health only, mga ganon. Just to adhere to the concept of prevention of colon cancer.
So ito talaga, if you want to check the health of your colon, it's really through colonoscopy. Wala na pong iba halos,
Well,
di ba?
of course, there are other strategies that we can do. You can do a FIT test. Ang FIT test po is stool exam with FIT test. Now, FIT is to isolate blood in the stools.
I see.
Okay. Blood that comes out in any part of our body is not common. So, pag
Okay.
lumabas ho sa puwet nyo yun, dapat ho, huwag nyo sabihin hemorrhoids
Yun
lang yan.
kasi actually, Doc, good point. Maraming nagsasabi ng ganyan.
Those are people, of course, it is common to have hemorrhoids, but you have to be sure that it's really coming from the lower part and not from the upper part.
I see.
Polyps bleed, inflammatory bowel bleeds, infection bleeds, and colon cancer bleeds.
So all of these have one common symptom. Kaya kailangan you have to zero in kung ano talaga yan. Kasi di ba, Doc, lahat naman ng cancers, if caught in a very early stage, is still more
Yes,
manageable.
I have already said that colonoscopy prevents colon cancer.
Okay.
Because at an early stage, we can do surgery of this colonic polyp. Hindi nalalaki to become cancer. It's totally different from breast. Breast from the start is small, it's cancer already.
I
Colon
see.
takes time. So pag
Oh.
nakita namin yung pasyenteng late, ba't naman hindi to sinabihan mag-colonoscopy? There are so many actors, actresses, presidents of the Philippines who died of colon cancer. And we should not be there because that is why the government has done its share. Nasa YAKA program, nasa PhilHealth packages. So I think everybody should undergo this procedure. If not, do a stool exam with fit test. Pag positive ho yung fit, ibig sabihin may dugong lumalabas sa inyo.
That's for colonoscopy ka na?
Definitely.
For colonoscopy. Okay. So, kung ayaw mong mag-colonoscopy muna, stool exam with fit test. This is still, kumbaga, it's less time consuming kasi, syempre, colonoscopy.
Mahirap. At pag positive, pupunta ka pa. So, there are programs that we adhere to. So, yun siguro ang medyo magandang mapag-usapan ninyo ng primary care physician.
Tama, okay. So, Doc, so basically, all this is all preventive measures,
yes,
diba?
Because as I mentioned, most of the cancers are prevention.
Like, tama naman,
for
yes.
breast, if you, as I mentioned, it's totally different. Sa breast, maliit pa lang yung cancer. Maliit pa lang cancer. But you can prevent its spread, right? So,
through mastectomy, lumpectomy.
Pero sa amin po, we have a lot of leeway to prevent something because it grows with time.
Yes.
Of course, there are certain cancers that from the start, it's serrated polyps that actually becomes
aggressive
as compared to the benign to malignant. So it's about 10 to 20 years. So parang lumaki yan, 5 years, 10 years. So that's why we recommend 50. Then our age of colon cancer is about 60 to 65.
So how long, kung alimbawa, Doc, 50 is your first colonoscopy, routine, how?
It depends on what we see. If you're normal, you're good for 5 years. If we see a polyp, it depends on that stage of the polyp. So pinag-aaralan na po namin yan early on.
And it's different from person to person, so you cannot generalize.
Yes, it's different, especially if you have a history. Iba po, sir, pag ang meron sa pamilya nyo na may colon cancer, that's totally different.
Genetic predisposition.
You need to have colonoscopy early on because colon cancer is also
genetic.
Yeah, it's also hereditary.
So, in other words, kung alimbawa meron kayong lahi, dapat responsibilidad nyo na talagang kailangan either magpa-cancer markers or itong mga...
Well, yes, because it's actually your doctor who should be able to tell you. So, remember when you go to your physician, kinakausap mo na kayo, ano na bang, paano namatay nanay mo, tatay mo. So, more or less, you have a demographics already of what you are.
Right.
And having said that, ibig sabihin, alam mo na kung paano ka pwedeng mamatay in the future. So, like, if you have a liver cancer in the family, you have to be able to screen. So, if you have patients, your father died of a heart disease, mag-ingat ka na rin sa iyong cholesterol.
Yes.
So,
tama.
These are things how you can actually be, because we feel that we should live longer than our parents.
Yes. And also, Doc, no, bukod sa living longer, syempre we want the quality of life.
Yes, of
and that's the best way that you can do it is to do preventive measures. Kaya bago pa mangyari ay ina-address na natin. Tama?
Opo.
Okay.
Yes.
Doc, ito, other than bleeding, no, what are some of the other symptoms po
Well,
of
you have a
colon
change
cancer?
in bowel habits.
Okay.
Kunyari dati, regular ka, biglang hindi ka madumi.
Constipation po ito.
Constipation. Because it's logical. Yung dumi, tumatagal sa colon, so there is more contact time. So yun, you actually have problems of translocation. And this is where you now draw the fact that constipation is one of the key factors. Doktora, dumudumi ako lagi, wala akong colon cancer. Mali rin yun. Because at an end stage of colon cancer, you can have more of this kasi nag-iiba kasi yung bowel habits mo.
Right.
So this is where the problem lies.
Even yung frequency is also another...
You will also be surprised there are young patients that we do not have any problems. So that is why may recommendation na kami, not based on symptoms, based on age.
Based on
so
age.
45 to 50, go to your doctor, discuss options. If you don't like, do a fit test. And if it's positive, undergo colonoscopy.
Okay, naku Doc, marami pa tayong pag-uusapan. And of course, when we come back, pag-uusapan naman natin yung atay natin because it's also a very important organ. So don't go away. Magbabalik po ang Agapay Tatak Rosa Rosal makalipas lamang ng ilang paalala.
2025 was a meaningful year for Bingo Plus Foundation. As our purpose grew, it was time for a new chapter. Introducing DigiPlus Foundation.
Education is the bridge to opportunities. Through the Future Smart program, we empower learners and educators nationwide. At DigiPlus Foundation, we multiply learning for a better future.
Healthcare should come with no barriers. Kalusugan Plus delivers medical missions, and Embrace Plus mental health support, which empower every Filipino through compassionate and accessible healthcare. At DigiPlus Foundation, we multiply healing. One patient, one community at a time.
Every dream deserves a chance. In Wish Plus, we grant wishes, empowering individuals, families, and communities together with their partners. At DigiPlus Foundation, we multiply hope, dignity, and possibilities.
Disasters don't wait. Through the Bayanihan Plus program, we mobilize immediate response and recovery efforts. At DigiPlus Foundation, we multiply the spirit of Bayanihan across the nation.
DigiPlus Foundation is committed to delivering on our promise to bring help within everyone's reach. When support becomes accessible, impact doesn't just grow, it multiplies.
Madaling pa ba mag-cash in sa Bingo Plus?
Sa Bingo Plus.
Official partner na namin ng Bayad Center. Easy!
License ba yun ng Pagcor? Sa Bingo Plus.
Kaya responsible gaming lagi.
Ang fun!
Gaming? Na may insurance?
Sa Bingo Plus.
Sa PhilFirst, insured ang wallet mo ng 1 million pesos.
Safe nga! Talaga namang...
Sa Bingo Plus.
Partnered with Bayad Center, licensed by Pagcor, protected by PhilFirst.
Sa Bingo Plus.
The best players succeed because they set boundaries. Every great athlete wins with control. Always have a game plan.
We want Dubai to be number one. That's the vision. Back then, it seemed like a desert dream. But we had brothers who believed that our desert is a land of endless opportunities, who believe nothing is impossible to a willing heart. The Filipinos. And so they came, the best and the brightest, with the will and the skill to build the biggest and the tallest. Shukran, brother Filipinos. Your hearts and your minds help give life to our Dubai dreams.
I am Chris. I am the Philippines.
Nagbabalik po ang Agapay Tatak Rosa Rosal, and still with our special guest, Dr. Diana Payawal, a gastroenterologist and hepatologist. Doc, kanina we were talking about colon cancer, colon concerns, and the most important thing is preventive and also recognition of symptoms.
Correct.
Ngayon naman, because you have two specialties, and very important din itong ating atay, Doc, no? Because if I'm not mistaken, it is one of the largest organs, diba,
Yes,
of our
that's
body.
true. But it seldom complains.
Yes.
So, ang mga taong may sakit sa atay, may sakit na sila pero wala silang nararamdaman.
It's asymptomatic.
Yes. Once you develop symptoms, it's sometimes already in the end stage.
Too late already. Kaya if we were talking about preventions and preventatives dito sa colon, mas more pa dito sa liver.
The only way you can prevent the liver is to check it up.
How
have
do
a
you do
checkup.
that?
Well,
SGPT, SGOT, blood test ba?
Blood test, then we have now a test to isolate fibrosis, ultrasound, and of course the fibroscan. We do a lot of checking of the test, yung mga apri test. We do a lot because one test will not fit.
I see. Ano yung Doc? Ano yung very basic? Like for example, kung di ba, when you have an executive checkup, usually andyan yung SGPT, SGOT.
Yes, we used to think that that's a surrogate marker. Surrogate meaning, pag mataas siya, alam mo nang may sakit siya.
Pero hindi totoo.
Oo. Now, pag normal siya, you still have to go one step. Do
Which
an ultrasound.
is ultrasound.
And then,
this is whole abdomen ba yun, Doc?
Of the liver and the gallbladder and the pancreas, usually the upper. Part yan ng checkup eh. And then if it is, you see fatty liver, you do a fibroscan. So we go, scan lang yun. Hindi ho yun yung CT scan. No. It's not, it's just like based on identification whether your liver has too much fat or is already matigas, cirrhosis. So, meron na ho tayo niyan. Technology was brought back here to the Philippines.
Okay. Doc, and usually pagka nagkakaroon tayo ng problema sa atay, no, like you said, basically with benign polyps, matatanggal natin yan, and usually we address the problem permanently until the next colonoscopy, kung meron man
so,
o wala.
When you have a polyp, it undergoes histopath. Then you go back to your doctor. Hindi pag porke natanggal, that's it. So you go back to your doctor, identify, oh sir, ano bang klaseng polyp ang natanggal? That will tell you whether you should go back after 4 years or after 2 years or after 6 months.
It depends.
It depends on the character of the polyp. Now, for liver, ang maganda po sa liver, your liver regenerates back to normal.
I see.
So, you hurt it, uminom ka ng alak, tapos nakita mo, ay mali pala tong alak. You stop it, then it goes back.
I see. So, kumbaga, it's more resilient.
Yeah, so-called, but at a certain point, it does not go back anymore.
So it depends. That's why they say occasional drinking. Like
the recommendation now is no drinking.
No drinking at all. Doc, yung sinasabi nilang red wine, yan, because
that doesn't make sense. I will put my foot forward. Sinabi na ho namin that in cardiology they say 1 glass. Hindi na ho yan totoo. Kasi yung 1 glass nagiging 2 glass, or sometimes you do it every day. So when you drink every day, that's 1. When you binge drink, kunyari, tapos ng trabaho, I presume mga lalaki po itong nandito mga cameraman, minsan nagbi-binge drink yan. So ibig sabihin, iinom ka ng 2 to 3 bottles of beer in 2 hours.
Which is... Okay. So, Doc, pagka ganyan, no, ang nangyayari is you are sort of suffocating the liver, tama ba yun? Or drowning the liver?
No, alcohol is a direct toxic effect on the liver.
Direct toxic?
Direct yan, hindi na yan direct yan. So, you remove it, you don't need to do what other people, ito ho, inumin nyo, pag uminom kayo na you just stop drinking, it goes back to normal. But as I mentioned, at a certain point, kunyari, umiinom ka na araw-araw, nagbi-binge drink araw-araw, you can actually develop already a liver disease.
I see. What are some of the common liver diseases, Doc, at least?
Well, in the Philippines, the most common before the vaccination of hepatitis B is hepatitis B. Then, because of the drugs before, hepatitis C came into the picture.
Ang dami na nga eh.
Pero, huwag na natin pag...
yes.
But drugs is highly related to hepatitis C. Ngayon po, ang nakita namin, kasi nga maganda na yung vaccination program, hindi naman maganda, but it has...
More complete.
Yeah. I think more people advocate vaccination for their children. Ngayon po, fatty liver disease. Dalawa ho yan.
This is lifestyle also.
Alcohol and non-alcoholic. So, So yung alcohol, of course, as I mentioned, we don't advocate drinking, especially if you have fatty liver from the start. And if, let's say, for metabolic associated fatty liver disease, if you have high cholesterol, high triglycerides, type 2 diabetes, obese, 10% over excess body weight, your risk to develop liver disease is very high.
I see. So, nako, definitely you also have to know yourself and you have to...
Yes, at a certain point, maganda hong malaman kung what, let's say, ay, hindi naman, alam niyo naman ang mga Pilipino, sir, lahat ho yan may inom ng alak. Okay. So, you need to know how to drink. If ever you have to drink, hindi ho laging everyday. I directly abhor the drinking of heavy drinks, yung mga gin, you know, mataas ho ang alcohol content nun.
Right.
Spirits is now becoming one of the more common thing, wines and all of this. But remember, red wine carries a high alcohol proof content than white wine.
So, talaga? Doc, so white wine is
less alcohol proof. So, but some people do not like white wine. They want a heavier one. So, I think the point is not to drink every day, not to binge drink. Let's say you are in a meeting, okay lang yung one or
a couple of
but
sips
next
also.
day, huwag ka na uminom. So, but as I mentioned, our recommendation is not to drink, especially if you have diabetes, you have fatty liver disease.
Okay, kasi it can definitely...
It can aggravate. You can have two diseases, and that makes you prone to a more common liver disease. But the good thing about it is, alcohol, if you stop drinking, you can revert your liver disease. O revert ibig sabihin, meron kang fatty liver, fibrosis, pwede hong maging walang fibrosis, and you can go back to a normal.
Depending on yung para bang how good you are.
Yeah, how good you stop drinking.
Okay. Pero Doc, no, because we come from yun nga, a drinking culture, no? So sa ganito, how often should people really check their system? Like kanyan.
Kami ho, what we recommend is you, at least after the age of 45 to 50, you do your labs already.
Okay.
So, alam mo na kung anong dapat mong gawin, no? So, and you more or less identify, kunyari mataas ang cholesterol mo, then, especially for men, the recommendation now is gone down to 30 to 35 years old. Kasi po, nakikita namin at 50s maraming inaatake sa puso. So, you go backtrack. So, identify, nandun ka ba? Mataas ba cholesterol mo? Mataas ba LDL mo? So, this is where you now draw. Pag mataas ang LDL mo, so lifestyle, pag hindi makuha, may mga gamot.
Okay. And these are usually maintenance medicines already, no, Doc?
Maintenance in the sense that you put it down, and once it's down, then you can actually,
you can keep it down. And that is where lifestyle change will factor in na, di ba, Doc?
Yes, correct.
Kasi kung para bang ang pagkaganyan, kailangan gumawa ka rin ng hakbang to be responsible for yourself.
Correct. I think the key factor here is lifestyle. It should be something, kaya nga lifestyle, buong buhay mo na yan. So from the start, I think all textbook tells you fruits and vegetables, Mediterranean diet, nuts, are actually the number one food that we need to take. But sometimes, may lechon tayo. The Filipino food is highly salty and highly fatty. So you need just to choose your food.
Okay, and also with the frequency or balancing the things that you need to do.
Yes, and of course, at the end of the day, you need to do a checkup.
Doc, speaking of checkup, di ba usually this is recommended at a certain age annually, no? Pero kung alimbawa, you also have an excessive lifestyle, sometimes you have to do it more often than once a year.
Well, the key there is you check up, find out kung mataas ang cholesterol mo or your sugar is up high and your liver is then you repeat it. You do certain lifestyle, after 3 or 6 months, it doesn't go down. I think you need already to see your doctor for medications.
Right.
So I think the bottom line here is identifying that you need to change, but sometimes that doesn't work. I guess a lot of you would like to do weight reduction. doktora, wala na akong kinakain, tumataba pa ako. So there are now new drugs that helps you on weight reduction. So these things are very important because before you have an end organ damage, meaning before masira po yung puso nyo, before masira po yung kidney nyo at yung liver ninyo, then you start to identify already, talk to your doctor whether medications will help.
Kasi yung mga ibang organs, no, like for example, kidney, pagka nasira mo yan, that is irreversible, eh, di ba? You will just
Well,
have
it
to
can
manage.
progress. No? So, what you don't like is progression.
Oo.
Sa liver, what you do like is reversion. So, yun yung difference naman natin.
Okay. Doc, I know that this is a little bit before we go on a break, no? Pag-usapan naman natin yung obesity in children. Marami na ngayon, Doc.
Yes, that's why now...
Napapansin ko, parang they're...
Yeah, because before, I have 3 kids and I would, dati ang nasabi ng mami ko, pag mataba ang anak mo, less yan nagkakasakit. Ay, hindi na po. So, ngayon po, what we need to advocate, especially now with technology, people just do not do, they do sedentary, computer or so I think we need to go back into telling them to play sports,
right,
to do things, because that's how you advocate the discipline not only of sports but also of lifestyle.
And also, sa totoo lang, on top of everything else, it also makes you look better because you will be more fit, di ba? People who exercise tend to look younger.
That's why now we have a correlation now with pediatric and adults. So this is the transition of medical care from the pediatric room, because of what you said. They start very early, we pick them up, and we tell them already as early as that time how to actually change. And the mother and the family support system is very important.
Is very important. They also have to make sure that discipline, di ba, and
Yes,
proper values are also not only in the classroom but also for the body, because sa totoo lang, at the ako, I always say this, Doc, ang tunay na kayamanan natin ay yun ating kalusugan, because yan ang nadadala natin kahit saan tayo pumupunta, di ba? It's, at a certain age, functionality is priceless.
Yes, that's true. At saka ito po ang uubos ng inyong retirement benefit.
Oo, kahit na bilyon ang pera mo, kung alimbawa you get diagnosed.
Everybody, no matter, well, you know how Steve Jobs dies.
Yes.
Died of pancreatic. So, nakikita nyo po na kahit gaano kayo kayaman, at the end of the day, it's your health that will actually tell you. So, we all want to live long, to have a very good lifestyle after retirement. So, I think checkups, lalo na siguro yung may mga kumpanya na may mga sistema naman ng HMOs. No? These are
Take
very...
advantage of it.
Ang kadalasan kasi, because when you're young, you think you cannot...
You're invincible, totoo. Kala mo you can do anything, which is I'm also guilty of that.
So, what we now tell our younger members, actually the one visiting my clinic now are younger, which I am very happy because they see their disease early.
And they see the importance of having a doctor on board, kasi katuwang natin ito sa ating kalusugan.
Well, now kasi technology has gone its role. We have telemedicine. I always say the Philippines is an archipelago, meaning we are separated by bodies of water. Having said that, if you are in the northern part of the Philippines, you can still get a medical specialist by telemedicine. So yan po ang one of the ways we actually produced during COVID. So ito po ay na-pick up, and as we have always said, dapat po nasa gabay po kayo ng isang doktor. It doesn't have to be a specialist. You can have a primary care physician who will tell you, ito, pang-specialista na itong sakit na to. Then you see a specialist.
Okay, so Doc, it's also understanding your body and linking it to the right physician.
In fact, in Europe, we send these gadgets. No? So we send gadgets. They send gadgets to this person. Kunyari, nandun sa northern part, papadalang kayo ng pulse ox and all of this, isang gadget. And then you take your parameters there and send it over to us here in Manila, and we can actually label laling yung mga blood sugar. Marami na akong gumagawa niyan sa atin.
Meron din yung mga
So,
nakakabit na.
mga gadgets. So, in other words, healthcare, distance should not be a problem.
Okay, that's very important. It's not an excuse na hindi
Correct.
kayo, hindi nyo aalagaan ang kalusugan ninyo. So, anyway, Doc, thank you very much for that. And magbabalik tayo on the 3rd. We will be talking about possible solutions na lang in general para sa ating mga kababayan para manatili silang malusog sa pagbabalik ng Agapay, Tatak Rosa Rosal.
"2025 was a meaningful year for Bingo Plus Foundation. As our purpose grew, it was time for a new chapter. Introducing DigiPlus Foundation."
Education is the bridge to opportunities. Through the Future Smart program, we empower learners and educators nationwide. At DigiPlus Foundation, we multiply learning for a better future.
Healthcare should come with no barriers. Kalusugan Plus delivers medical missions and Embrace Plus mental health support which empower every Filipino through compassionate and accessible healthcare. At DigiPlus Foundation, we multiply healing. One patient, one community at a time.
Every dream deserves a chance. In Wish Plus, we grant wishes, empowering individuals, families, and communities together with their partners. At DigiPlus Foundation, we multiply hope, dignity, and possibilities.
Disasters don't wait. Through the Bayanihan Plus program, we mobilize immediate response and recovery efforts. At DigiPlus Foundation, we multiply the spirit of Bayanihan across the nation.
DigiPlus Foundation is committed to delivering on our promise to bring help within everyone's reach. When support becomes accessible, impact doesn't just grow, it multiplies.
Madaling pa mag-cash in sa Bingo Plus?
Sa Bingo Plus. Official partner na namin ng Bayad Center. Easy!
License ba yun ng popcorn?
Sa Bingo Plus. Kaya responsible gaming lagi.
Ang fun!
Gaming? Na may insurance?
Sa Bingo Plus. Sa PhilFirst, insured ang wallet mo ng 1 million pesos.
Safe nga! Talaga namang...
Sa Bingo Plus. Partnered with Bayad Center, licensed by PAGCOR, protected by PhilFirst. Sa Bingo Plus.
The best players succeed because they set boundaries. Every great athlete wins with control. Always have a game plan.
Nagbabalik po ang Agapay, Tatak Rosa Rosal, and on to our third and final gap po, body po. And still with my guest, Dr. Diana Payawal, of course, Gastroenterologist and Hepatologist. Doc, kanina off-cam, no, nag-usap tayo about tattoos. No? Siyempre, I did not
because
quite...
I see a lot of patients with tattoo. Yung sleeve tattoo, yung buong kamay. So, I think one of the things that we as hepatologists would say is you be careful because alam na natin that it can transmit hepatitis C.
I see. Hepatitis C. In particular.
So,
okay.
why? Because, yes, they change the needle, but they don't change the solution. So I think we have to be very careful with that. Plus, the solution itself carries, of course, some chemicals that
because
can
this
affect
is
the body.
foreign, foreign.
Ngayon, ang gusto lang namin is you understand the disease. So I always tell our younger members, kasi yung sleeve tattoo, uso-uso yan, yung buong kamay, buong paa, no? Just be careful.
Okay. So, kailangan you also have to have a responsible, kailangan, kumbaga, suriin ninyo yung tattoo artist also.
well, it's an art, but I have reservations over it.
So kumbaga, in other words, if you can just avoid it, better to just get a henna tattoo.
Siguro
O gano'n na, magpalagay ka na ng maraming henna tattoo. At least, mababago-bago po nyo pa.
Because hepatitis B and C is related to tattoo, to, of course, blood transfusion, anything that you need. Kasi minsan pag nagtatattoo, di ba, they use needles, they use these things. So ayaw natin po yun. Because the skin can absorb it.
It is also invasive in its own way, di ba?
Yes, and I know that there's an art behind it, but as I mentioned, you just have to be careful when you do it.
Okay. Okay, Doc. So that is a good footnote, no? So ito, Doc, how do we give advice, no, to our viewers dito sa ating programa and sa ating bansa on how to take care of themselves better? Kasi I think that this is really something hindi nila nare-realize until it's too late,
Well, of course, the recommendation has been there. Any doctor will tell you to eat properly. I think that's basic. Away from processed foods, away from alcohol. Those that are like smoking and vaping, I think that's a lifestyle that you should really avoid.
And Doc, like off-cam kanina, sinasabi natin, babalikan ko lang yan, kasi maraming tao iniisip nila na vaping is safe and smoking is not. Just for clarity, hindi totoo yun. It's the same.
And even worse, because in smoking, it's nicotine.
Okay.
In vaping, you don't know what the chemicals are
inside that little
thing. So I think we have to be very careful on that. I've seen, I'm a GI, so gastro. So I see its effect in ulcers, in esophageal ulcer, esophagus na, ulcer. Ang hirap po i-treat yan. And then even in peptic ulcer disease, it has been linked. So it has been linked to a lot of things. This is a new disease. This is a new chemical that we're putting in our body. So we have to be very careful when you do this. Now, all textbooks will tell you fruits and vegetables, and of course, as I mentioned, Mediterranean, gulay, nuts, brown rice, all of this. Now, you have to be very careful because diabetes in the Philippines is rising at 1 to 2% per year. So, which means, carbos, white rice. So, you have to be careful also with what you eat. So, I think choose your food wisely. And of course, at the end of the day, sleep is important.
Those are the things that hindi ko na yan nakukuha. 2 to 3 hours a night is already a lot.
I think there are already a lot of articles. The data is very robust on sleep as a way of preventing diseases. So I think it's lifestyle at the end of the day. Now, of course, with this, you have to have your doctor to remind you what to do sometimes. And at the end of the day, it's you. So kahit sabihin ng doktor mo, isang oras ka nakikipag-usap, ganito gawin mo, ganito. Paglabas mo, kakain ka ng fast food. So these are things that you need to actually enhance. Now, at the end of these things is, of course, a very good family support system. So, of course, ayaw natin yung malungkot ka, depression, mental health, these things. So, it's a holistic strategy that you have to have.
Tinitingnan natin po yung kabuuan.
Correct. So, everybody has a way of adjusting to things. So, maybe for you, sleep doesn't work. But for me, it does. So you need to identify, you need to study your body. I always tell them, study your body kasi individualistic na ngayon na precision medicine na po. Hindi lahat ng pwede kay sir, pwede sa akin.
Yes, tama.
So, you need to identify what is good for you.
At saka, wag tayong siguro self-medicate because mahirap. May mga ibang tao ito ang kasi ganito ang naramdaman ko rin yan, tinake ko ito.
We are coming up with our guidelines on drug-induced liver injury from herbal medications, from yung pampalaki ng katawan, these things that you do in the gym.
Yung mga whey
sa akin ang
protein.
exercise, no? And then from drug-induced or medication. So our guideline from the Asian Pacific Study of the Liver, of which I am very fortunate to author, will be out already in 2 or 3 months.
Wow, that's amazing. So para bang this is also ways for people to understand their bodies. And
That not all medications or not all vitamins are good for you. There are some medications that claim to be supplements that claim to have good health. So hindi po lahat yun totoo.
And also, no, yung mga lalong-lalo na pagka nagte-take kayo ng antibiotics, so you can develop this.
These are medications
yeah.
that are good, but for certain people, it has side effects. No? I will give an example. Siguro yung mga antibiotics na sinasabi, they can affect the liver.
Yes, and kidneys.
And if you have a liver disease, these are the antibiotics that you should not take. So I think identification of the disease itself is
And also, you have to take the whole cycle kasi if not, you will have that multiple drug resistance also.
Yan ang problema ngayon sa TB.
So, tuberculosis in particular, no, because they feel better after 1 month, they stop taking it.
The recommendation is 6 to 9 months.
Right.
And the government has even done a strategy for resistance wherein you have to take the drug in front of the doctor.
Araw-araw po yan?
Oo, pupunta ka sa center, inumin mo yung gamot. Kasi nga, pag tumaas ang resistance, lahat po tayo damay.
Right. Because it's a highly contagious, di ba?
And no medicines will be able to help us. So at a certain point, you take 4 drugs, 5 drugs. So these are things. It also happens in antibiotics. No, that's why the antibiotic stewardship program of the hospitals and of the PISMID is actually working for that. So hindi lahat ng sakit kailangan ng antibiotic. So that is why you don't abuse these things.
So you also have to understand and respect medicines and how to take them.
Opo, hindi porke dito sa atin available kaya niyong uminom. So I think we have to be very careful on that. So I guess for me, the way I will look at it is you study your body with a doctor, be able to go for checkups. As I mentioned, YAKAP program, we did already our program for that. So the government is supporting you, so do it as often as you can. Go to your primary care physician, go to a YAKAP program doctor, para you can identify what is your problem in the next 4 or 5 years.
Ito naman, Doc, it's also, a popular question from people kasi ngayon, unlike nung panahon ko, na meron talagang oras ang mga tao to have breakfast, lunch, and dinner, na meron talagang oras.
Alam ko na intermittent fasting.
Hindi rin naman, Doc, no? Because ngayon, iba-iba ang uri ng trabaho
Yes.
So, para bang hindi na tayo nagkakaroon ng talagang tamang oras.
Correct.
So, many people nga revert to fast foods and processed foods because wala silang oras. It's just yung para lang laman siya na sinasabi, no? And I know this is what's causing a lot of lifestyle diseases. Ano ang dapat gawin ng mga taong ganito? Like, di ba, Doc, minsan, call center is one. People with multiple jobs. Hindi na natin or walang oras para mag-prepare ng masustansyang pagkain. Ganon.
Yes, we all fall into this trap. Even doctors, we do 24 hours duty, even 48 hours duty. But we survive because nakikita namin na if we don't also take care of ourselves, we also develop the diseases that you see in patients who actually have that kind of a lifestyle. So I think the key factor there is to be able to adjust properly. Hindi naman porke nasa BDO ka or hindi ka natutulog sa gabi, di matulog ka sa umaga. Get your 8 or 10 hours of sleep there. The recommendation is 8 or 10 hours. But we found out that even those working in BDOs, no matter if they have an 8 to 10 hours sleep, they still have the same disease. So I think that's why it's important. What I do if I have a BDO patient that has to have this magnitude of work, nakita ko may sakit, I write the supervisor, can you transfer her to a strategy? Kasi yung circadian rhythm natin nag-iiba.
When you work day and night shift.
Nag-iiba po talaga. So, and we found out that no matter how much you say, kasi you cannot sleep in the day. Kasi bukas ang ilaw.
At saka there's so many things going on. Ako nung nag-start ako bilang reporter at saka nasa graveyard shift ako, ang hirap eh. Parang yung you try to sleep during the day, pero definitely you will wake up because you have other responsibilities that are needed during the day.
That's true. That's why the lifestyle of patients, of our younger members, I think most of you here work at night, no? So I think you just have to adjust and get the 8-hour sleep, make sure that you eat the Mediterranean diet, fruits and vegetables and nuts, and of course more on less on red meat.
Yes,
and
red
don't
meat,
fall into the trap of drugs to make you awake, or
drugs to make you lose weight.
Drugs to make, of course meron na ho ngayong mga I need to correct that. There are a lot of good drugs that helps you lose weight.
I see.
So this needs to be under a physician. Kasi,
Supervision.
Yan ang, if you were listening to Trump, it's a very expensive, but Trump understands that obesity is killing America. So ang ginawa niya, binabaan niya yung gamot. Ang galing nga ng sistema na they actually help in addressing. But you know, the government is addressing. As I mentioned, let me reiterate, YAKAP program, make use of that.
Right, because it's there for you.
Yes.
So Doc, for our viewers po na nais pang mas personal ang tanong, saan po kayo nila
Well,
pwedeng...
I'm with the Cardinal Santos Medical Center and of course with Fatima University Medical Center. So you can just call and they will be happy to entertain you. We have programs in both. Kung colonoscopy lang ang problema, I have programs in both. I handle the Antipolo and the Valenzuela area. So this is meant for the community.
Right.
So,
okay.
so for the metropolis, I have Cardinal Santos. So we all have programs in all of these centers. I think that's a mandate of most of the doctors to be part of programs that will help address these disease entities.
Okay, so thank you very, very much once again for giving us your time,
It's my
Doc,
pleasure, and I hope I was able to transmit the information.
Kasi yun nga, again, many people are scared. You know, I don't know whether they're scared or whether they're scared to find out. You know, but either way, it's bad. Kasi kailangan, the earlier you find out, the easier. And the more you can do stuff about it, di ba?
Correct, yes. And there are support programs to help you.
So let's be responsible, let's respect our bodies, and let's move towards a healthy, long life. So thank you, Dr. Diana Payawal, Gastroenterologist and Hepatologist, past president of the Philippine College of Physicians, past president also of the Society of Gastroenterology, and past president of the Asian Pacific Study of the Liver.
Thank you, sir. It's a pleasure to be here.
Thank you. And once again, I hope that marami kayong natutunan dito sa episode natin ng Agapay. And again, next week po, please be with us for your teledoctor na rin tayo dito somehow. Although hindi tayo nagbibigay ng any diagnosis, but at least yung mga viewers natin na meron man nararamdaman na hindi nila ma-recognize, at least we can lead you into the right direction.
Yeah, okay.
Okay.
I understand. Thank you
very much. Until next week, nagpapaalam na po sa ngalan ni Rosa Rosal. Ako po si William Thio para sa Agapay.
Thank you, Dr.